In today's video, we're going to be using the KenHub website to learn the musculature of the hips and thighs. Okay, so our focus in this video is going to be discussing the muscles of the hip and thigh. And so we're inside of a study unit on the KenHub website. And what you're going to see if you're following along at home is that there is quite a bit to this study unit. So if I scan down, we're going to immediately see that we have a video all about the muscles of the hip and thigh, which makes perfect sense. But then if you continue scanning down, we're going to see that there's videos rather, specifically on the glutes, the inner hip muscles, the muscles of the anterior thigh and the posterior thigh and hamstrings. So there's a lot to cover here, and we're obviously not going to cover it all. I mean, these videos are fantastic resources in and of themselves, and my goal is not to simply just repeat what they're doing. Instead, I want to focus on kind of some more of the broad strokes of these muscles, but give you still a real good understanding of what they are, why they are, and how just even visually looking at them can be useful in understanding more about the muscles of the lower body. So I'm going to quickly scan by this quiz that we will be coming back to because we want to make sure that we are tracking along. And we're going to see the atlas here. And this is what we're going to be focusing on. And immediately as you look at this, there's quite a few muscles. But I'm going to click this button. You're going to see there's a whole lot more. You see, this is a posterior view that we're looking at right now. So you can see like this muscle here would be the gluteus maximus. I mean, this is a pretty good indicator that we're on the posterior side. But you can see just how many muscles are here. And you can see that this circle is also zooming in based on the musculature that is deep to the gluteus maximus. So then if I flip onto this image, this is an anterior view. So this is like you're looking at the front of the hips and then the front of the thigh. So this is, again, there's a lot of muscles here. My expectation is not that we're going to go over and list all these different muscles and then you're going to come away from this taking a quiz at the end of the video being like, oh, yay, I know all these muscles. These things take practice. Muscles are one of those things that I'm always telling my students, you gotta practice a lot. For me, I don't know how this is gonna come across, but I did not really feel secure in my knowledge of muscles until I started teaching. And it's not that I didn't feel like I understood them at all. It's just that the point in which it became so reflexive was because I was saying it all the time. So even if the knowledge is in your head, you may not be able to just immediately and reflexively say it, and that's because it's just going to take practice. And my hope is that, this is the first video maybe that you could watch that could kind of kickstart that process. So enough yapping. Let's go ahead and take a look at this. So again, this is an anterior view, and I want to bring your attention to this area here. So we have this is essentially the lumbar vertebral column, although there are 6 vertebrae here. So if we count, you have 1, 2, 3, 4, 5, and 6. And you might remember from, the very early on in your anatomy program that there are 5 lumbar vertebrae. And that's because you are seeing T12. This is the 12th thoracic vertebra, and then you're seeing the 5 lumbar. And then we can see as it's transitioning into the sacrum and the coccyx, and then we can also see it starting to split into what's called the appendicular skeleton. Now, this is a lot of words, and my hope is that you're able to somewhat follow along with me as I'm saying these things. What I mean here is, this is the axial skeleton. Axial is based on the center, right? Is what you can turn and spin around. So your head, your neck, your chest, and mid-back, and then your low back and sacrum, those are running down the center of your body, right? That is the axis in which you can spin and twist. We call that the axial skeleton. And then when it comes to your limbs, these are your appendages, right? So you have your upper limbs, you have your lower limbs. Those belong to the appendicular skeleton. And so you're seeing the transition point between the axial and the appendicular skeletons. And so we're seeing the musculature of the deep hip. So basically, if you removed your intestines, so your small and large intestine, and then a lot of different connective tissues that are anchoring them to the body, what you're going to find are these muscles. And so the first muscle we can see, or rather, maybe I shouldn't say first, the first one I want to bring your awareness to is going to be the psoas major. So the psoas major is this thick muscle that comes all the way up and starts attaching onto that lumbar vertebral column. But then if you look really closely, there's also this really thin muscle next to it. And you can see it labeled here as the psoas minor. Now, psoas, these are, I hope this isn't going to be too much. These are the tenderloins. So if you think about like tenderloin possibly in like a cow or a pig or something along those lines, that's the psoas major muscles. And the psoas minor can be along for the ride. These are going to be very strong muscles. Well, maybe I should say psoas major is very strong. Psoas minor is actually very thin. It's actually on its way out, evolutionarily speaking. So there's a good chance that you might not have both of them. You might only have one, or you might have none of them. And that's okay, because psoas major does everything that psoas minor does and more, and it does it better. But regardless, you have these really powerful muscles here in the attaching to the lumbar vertebral column that we call the hip flexors, along with this muscle right next to it called the Iliacus or the Iliacus. You can kind of say it either way, whatever makes you happy. And they together form what we call the iliopsoas. The iliopsoas, these are the hip flexors. So if you ever hear someone say like I tore or strained a hip flexor, you see this all the time in athletics. That is in reference to these muscles here. And what they're going to do is they're going to flex your hip, which is basically like, if you think of here's a good way, by the way, to remember flexion at a joint. Full body flexion is the fetal position. So if you were to put every single joint into flexion, you would end up in the fetal position. So if you think about then what is happening at the hip, the femur is coming anteriorly. That is a product of these muscles here. They are flexing the hip, which is why they are called the hip flexors. Now, if we keep on coming down, we see a whole lot of muscles of the thigh. And so in the anterior thigh, you're going to meet muscles that we call the quadriceps. Now, there's more than just the quadriceps in the anterior thigh, but most people are familiar with the quadriceps. And again, we can look at its name, or some of these names, right? Like rectus femoris, which is this really big muscle in front. And then on the sides, you have the vastus medialis, which you can see its name here. And then on this side, you have the vastus lateralis. Now, what you can't really see, and I'm looking to make sure, which you can't, if we could dissect away the rectus femoris, there is another muscle underneath called the vastus intermedius. All four of these muscles converge into one tendon that we call the quadriceps tendon, and then emerging out of it is what we call the patella. The patella, this is kind of wild. The patella is a sesamoid bone, which means that it's a bone that develops inside of a tendon. And then there's going to be more connective tissue that comes out of the patella and anchors the entire quadriceps to your tibia. It's a bony point on the front of your shin. So if you are to feel right now, just kind of go a little bit farther past your patella or your kneecap, you're going to feel this bump on your shin. That's the tibia. That's called the tibial tuberosity. And what's happening is all four of these quadriceps muscles are attaching to it. And in fact, the tension from those muscles is what is pulling on the bone to create that bump that we call the tuberosity. So those are what we call the quadriceps. Now, again, I said there's more than just the quadriceps to the anterior thigh. And what we can see here is what's called the Sartorius muscle. So where is it labeled? Aha. Sartorius, this gets its name from a tailor. So basically think like the inseam of your pants. What's cool about this image, though, we've cut it because it normally would go all the way up here from your hip down past the knee. This is the longest muscle in the body, possibly. You could say longissimus, which is in the back, is longer, but I don't really need to get into the nuances of like which muscle's longer. The point here is it's a very, very long muscle, and it's going again from your hip all the way down past your knee. But we've cut it so then you can see some of the deeper musculature in this medial thigh. So let's talk about it, because in the medial thigh, we find a separate muscle group called the adductors. Now, their real name is the medial thigh compartment muscles, but the adductors is a great name for it because guess what pretty much all of them are going to do? They're going to adduct the hip. So what that basically means, like if you think like a jumping jack position, when you are spread like this, bringing the legs back together, that is adduction of the hip. And these muscles are all going to do it. And so a lot of them have adductor in the name, which is pretty nice. So for instance, you're going to see adductor brevis. You're going to see adductor longus, which by the way, longus just means long. No surprise there. And brevis means short. So this is the short adductor and this is the long adductor. And then you see this one, adductor magnus. Is in reference to size. So it's just, this is like the thickest muscle in the human body, I think, comparatively. Like, it's between this one and gluteus maximus, I would say, are going to be like they're going to be running neck and neck for the thickest muscles. So, like, I mean, I'm always telling students, anatomists, they're kind of lazy. It's like you're basically looking at a muscle and you're like, okay, what does it do? Whatever it does, that's what I'm going to name it. So it's a big adductor. We're calling it adductor magnus. It's a long adductor. It's adductor longus. If you know how to break down these names, honestly, that tells you a good amount about the muscle and tissue itself. However, then we also can see gracilis. Now, gracilis is the most medial thigh muscle. So if you were to feel basically from the groin all the way down past the knee on the inside of the legs, that is going to be the gracilis. But then the other muscle I want to bring your attention to is what's called pectineus. Pectineus is an adductor, but like gracilis, they don't have adductor in their name. So pectineus is also going to perform flexion of the hip. I often tell people, if someone pulls a groin, like you see this all the time in athletics, like, oh, I pulled my groin or I strained a groin muscle, there's a good chance it was pectineus. Although it also could have been adductor longus. Although it could have been the whole bunch of other muscles. I mean, that's the whole point, right? Like, you can't really assume it's going to be one or the other. All we can say is that pectineus does get commonly pulled, right? This is more of a strain, but this is just going to be in the front of your groin. So basically, if we think about this, like the groin, the genitals would be right here in the center. If you just go right lateral, right along there, you're going to start seeing the pectineus muscle, and then you're also going to see adductor longus. Excuse me. So then if we go to this, so now let's go to the backside. So if we go to the backside, I want to stay kind of on the bigger image first, and then we'll zoom in and see what's going on underneath. So this massive muscle here is what we call gluteus maximus. Now, gluteus maximus is huge. Like I said earlier, it's debatable as to whether or not it is the thickest muscle in the body. It's between it and adductor magnus. But what I can tell you is that your gluteus maximus is so massive that you actually have the largest gluteus maximus in the animal kingdom. So what that means is you're probably like, Justin, what about an elephant? What about a rhinoceros? Well, the thing is, if you could scale a human to the size of an elephant, or an elephant down to the size of a human, then you would see that our gluteus maximus, compared to the rest of our anatomy, is massive. And that is because the gluteus maximus, as well as the other gluteal muscles, are involved in basically just keeping us upright during our bipedal locomotion. What I mean here is you walk on 2 feet. And your glutes are what keep you from falling on your face or falling and tipping over to the side. The glutes are awesome, right? So thank you, gluteus maximus, for being so massive, right? So you have a very large butt, and I say that with love and appreciation. Now, down here in the posterior thigh, you have heard of these muscles before. These are called the hamstrings. The hamstrings, there are 3 muscles. We have what's known as the biceps femoris, the semitendinosus, and then right behind tendinosus is another one called semimembranosus. Now, again, I'm not expecting you to memorize all of these names, but if you start thinking about their names, they're pretty intuitive. However, a lot of times people are surprised to know that there is another biceps. Right? Biceps brachii, we're all familiar with biceps brachii, but everyone just calls it biceps. But the name brachii tells you that it's in the brachium, whereas biceps femoris tells you that it's in the thigh. It's attaching to the femur. But biceps simply means 2 heads. And so what we can't really see that well in this particular image is that there is a long head and a short head. The point here is there's 2 muscle bellies that kind of converge into one singular point. Semitendinosus is called that because, well, I don't know if you can see this all that well, but there's a really long tendon here. So like half of it, or close to half of it, is muscle, and then the other half is a really long cord-like tendon. And you can feel this right now. If you like go into the inside of your knee, so like think like the back of your knee, and then go towards the inside, the medial side of your knee. If your knee's in a flexed position, like you're sitting, you can feel a cord in the posterior knee. That's the tendon of semitendinosus. Makes perfect sense. Then behind it is semimembranosus. If you were to dissect these muscles away, you would see that there is a membranous portion. It's like this connective tissue sheet portion to the muscle, and it's about half of it. Semimembranosus. I'm telling you, Anatomists are lazy, right? When they were going through these naming structures, hundreds of years ago, I'm telling you, there had to be exhaustion. There had to be just sheer exhaustion of these people. Just like, what do we call it? Just give it to me straight. Give it to me simple. I'm telling you, that had to be what happened. All right, enough of that. So then let's look here into the deep posterior hip. So if you could cut off gluteus maximus, that is what, and this is what you would see. You would see two more gluteal muscles that we call gluteus medius and gluteus minimus. And then you're going to see what we would call the deep hip rotators. So let's start with the other gluteal muscles. So there's actually 4 gluteal muscles, and you can kind of see one here. So if you follow this where it says tensor fasciae lati, if we follow this line, there's this thin muscle right here. The reason why it's hard to see from a posterior or anterior view, because it's on the side. The way I like to describe it, it's like if you have front pockets in your pants, like when you slide your hands into those front pockets, you're basically on the TFL. Because no one wants to say tensor fasciae lati, so we all say TFL. That is also a gluteal muscle, but people forget about it because it doesn't have gluteus in its name, whereas the other 3 do. Now, so gluteus medius is much bigger than gluteus minimus. Probably not going to surprise you, but gluteus medius is smaller than gluteus maximus. They're really just named based on their size. You have a big glute, a middle glute, or medium glute, and then a small or minimal glute. Now, all 3 of those are going to do similar functions. Again, they're all keeping you upright, and so you're not falling flat on your face or to the sides. Glutes are awesome. And then we have the deep hip rotators, and there are a lot of them. Well, I shouldn't say a lot. There's 6. I gotta stop saying a lot when there's not really a lot. There's 6 of these, but the one that's most interesting, because we're not going to go into each one of them, is you have what's called the piriformis. So piriformis got its name because it is shaped like a pear. And so if you look at this, you can see like, this would be like the body of the pear. And then right here where you have the tendon, that would be like the stem. So I think that's a cool name. Like you have a pear-shaped muscle and they're just like, piriformis. Really, really cool. But then there's other names in here. Like there's the superior gemellis, the obturator internus, the inferior gemellis, and the quadratus femoris. And I guess maybe we are going to go over the rest of these. The superior gemellis and the inferior gemellis, that means little twin. So you think like Gemini. Gemini means twin. So superior gemellis is a really thin muscle. Like, I don't know if you can see this all that well because it's so thin. It's just hard to see. This like pencil thin muscle just below the piriformis. That's the superior little twin, superior gemellis. And then underneath this other one here that we'll come back to is the inferior gemellis. Makes perfect sense. It's the little twin that is below. And then the quadratus femoris is very well named because it is a 4-sided muscle that is attaching to the femur. Great name for it. And then you have the obturator internus. This is named after a bone structure called the obturator foramen. Obturator foramen is just a hole in your pelvis, and this muscle is coming, like it's bordering around it. But what all of these muscles do is they all work together to perform lateral or external rotation of the hip. So it's kind of like, the way I like to think of it is if you're driving in a car, and it's kind of like you're turning your foot to hit the gas pedal, you are laterally or externally rotating the hip. These muscles are going to be involved in it. So again, all of these are going to be deep to the gluteus maximus. It just goes to show that it's a very busy area. So with that, that's a lot of muscles. Let's go ahead and start taking a quiz and see how we are tracking along with this. So I'm going to go ahead and reduce the time to 5 minutes. And what's cool again about these study units is we just embed the quiz right there. So you can just jump right over to it, see how you're doing. And I'm going to do a study session. You could also do an exam quiz. An exam quiz is there to, test you, like to say like, are you ready to pass an exam? Whereas a study session quiz is really there to help teach you. Really, really cool. I love both of them. If I had to pick, I personally like the study session the best. It's totally personal preference. All right. So let's go ahead and start this. And what we're going to see is 2 different muscles. But up top, we can also see where it's asking which image shows psoas minor muscle. So you could probably already tell which one is going to be which. even though you haven't memorized it. And so this is a good time to show you that if they took the time to call one of the muscles psoas minor, there's likely going to be a major. And minor is going to be in reference to being smaller. But I do want to click this eye icon so we can see this muscle more up close. And you can see that, it still has some size to it, but when you compare it to psoas major behind it, which I'm kind of spoiling this quiz, you can see that minor is a very good name for it. But psoas minor, you can see, is coming off of T12 and L1, and then it's coming down and it's going to attach here on the pubic bone. And why that's different is because the psoas major is going to go all the way down and connect onto the femur, so there is going to be a different function for it. So let's go ahead and get out of that. So the answer to this is going to be the smaller one, right? I think that makes a lot of sense. We can breeze through this question. Which image shows the psoas major muscle? That's going to be the more massive one. All right. Next, which image shows the iliacus or the iliacus? I always learned it as Iliacus, and then I heard someone say that it's probably Iliacus. I'm sticking with Iliacus. I'm sticking with what I learned. At the end of the day, pronouncing it, correctly every single time isn't the most important aspect. It's more about, can you identify it? Can you understand what it does, why it's there, those types of things. But I'm team Iliacus. All right, so if you look at this, these images look very similar to one another. However, you can see there are two things here, whereas there is one on either side. So what I want to do is, this is going to be the answer. It's going to be, this is the iliacus, but I want to zoom in here. Because what you're looking at is the combination of the iliacus and the psoas major. And we can combine them to call them the iliopsoas. So you'll often hear them be described as that, which is perfectly valid. But the reason why is because they share a common tendon of insertion. So basically, the psoas major is coming off of the lumbar vertebral column, whereas the iliacus is coming off of the ilium of the os coxa, or the hip. But you can see both of them are converging into a singular tendon, the iliopsoas tendon, and that is then going to insert onto the femur. So while this is definitely the psoas, and this is definitely the iliacus, when they combine, you could start really just calling them the iliopsoas, or you could think of them as two heads to one muscle. So really interesting that way, but this is going to be the iliacus. And then here enough. Which image shows the iliopsoas muscle? Well, that's going to be this one. All right. Now, again, this is another cool aspect about our study session quizzes, is because what we like to do is continue to expose you to the same information, but just adding a little more complexity to it. So we're going to try to go a little quicker. Psoas minor, I'm going to give you a second to look at it and see if you can determine which one. Enough time. I'm going to click this one. So yeah, this is the psoas minor. The psoas major, which one do you think it's going to be? Again, you can pause it if you need extra time. Yep, it's going to be this one. Then we get to the iliacus. Iliacus, we've also discussed. Here we go. Now, I'm really interested in this one. So, no, actually, it's going to be the next one. Iliopsoas. Which one's going to be the iliopsoas? Maybe I should just actually say it this way. Not that I'm interested in the next one, as much as I wanted to kind of like show you that it's also adding muscles that we haven't discussed. Now, we have discussed this one. But these ones, actually we did discuss those too, now that I think about it. I was thinking more specifically about a deeper muscle called vastus intermedius. It doesn't really matter. The point here is, it's nice that they're also kind of throwing in different aspects of the musculature that can be a little bit off site, a little bit farther down on the body. The point I'm trying to make here is, it's getting your brain to really work, because you're having to look in different locations and try to figure it out. But regardless, this one's going to be the iliopsoas. Kind of just rambling at this point. All right, what image shows the Sartorius? Now, if you remember, Sartorius, I told you, is named after tailor, right? So like kind of like you're going to the tailor, they're doing the inseam of your pants. I always ruin these quizzes. Every one of these videos, I keep ruining the quizzes. It's gonna be this one. All right. So that was only 5 minutes. Now, what's cool about our quizzes is that you can do this a lot longer. And Obviously, when you're not talking through it like I am, you can get through a lot more of these muscles. But again, the whole point of the study session quizzes is to really teach you all of the muscles and to like really spend time with the material to actually teach you the material. So I really encourage all of you to spend time with it. And then again, you can even see how well you're increasing or improving. Really, really cool. But I also want to just briefly go down here and show you other specific aspects that are a part of the study unit. So you can see different muscles. You can see that we have 16 different images, and this is going to go into each muscle individually. I decided just for the sake of this video to use the one image, but what is so cool about these study units is the fact that you can also look at them individually, and it can be really impactful that way. Again, you can even see on the posterior side here. And then you can also see in the study units like the key points. This is kind of just like summing up a good amount of it. And then you can even see some related articles. So study units are just such a powerful way to learn about these muscles. So I really encourage you guys to check them out. But my hope is that you got something fun out of this, that you learned something. Again, there's so much more we could have discussed, right? We could have discussed its innervation, the functions, the blood supply. There's so many more aspects to anatomy. It's one of my favorite things about anatomy is that, there's always more to learn. And so I encourage you to come back, to just spend more time here on KenHub, and you will be able to learn a lot more of those nuances. But in the meantime, I really hope you enjoyed today's video. If you have other structures you want to hear us discuss and teach about, be sure to leave that in a comment below. You'll also find links to KenHub directly in the description. So be sure to check out the KenHub platform, because there is so much more than this. This is the tip of the tip of the tip of the iceberg. So regardless, thanks for hanging out with me, and I will see you in the next video.